Welcome to the deep dive.
Great to be here.
So today we're tackling a really fundamental term, healthcare.
Yeah, one we hear constantly.
We went straight to the source, Merriam-Webster, to get the definitions.
And the idea is to peel back the layers, right?
Yeah.
Understand what's really at the core.
Exactly. It seems simple, but getting clear on it can really help understand the bigger picture.
You know, sometimes we use these words so often, we forget to think about what they precisely mean.
Totally.
Yeah,
So Merriam-Webster gives us two main definitions.
that's right. And exploring those should give you, the listener, a much richer perspective.
Okay, let's start with the first one. What does it say?
So definition one focuses on the actions. It's
Yeah.
about efforts made to maintain, restore, or promote someone's physical, mental, or emotional well-being.
Maintain, restore, or promote. That's broad.
It is. And there's a key qualifier,
Which is...
especially when performed by trained and licensed professionals.
Okay. So the efforts are central, but also who is performing them.
Precisely. It covers the whole spectrum, keeping people healthy, fixing them up when they're sick, like one quote puts it quite simply.
And it explicitly includes mental and emotional health, too. That feels important.
Definitely. It's not just physical ailments. The medical definition actually gives examples.
Like what?
Things like medicine, obviously, but also dentistry, clinical psychology, even public health.
So it's really about recognized professional fields.
Exactly. It distinguishes it from, say, just getting advice from a friend, even if that helps your well-being.
Right. That makes sense. It formalizes it. It's about expertise.
And there were some usage examples that illustrate this.
Yeah.
Well, one mentioned improving access to quality healthcare, especially in rural areas.
Okay. So that's about the delivery of those efforts on a community level, promoting well-being.
Right. And another example talked about wearable tech.
Oh, like fitness trackers and things?
Exactly. How those devices can empower people towards self-care.
Interesting. So technology is playing a role in these efforts now, letting individuals be more active.
Yeah, often guided by or in consultation with professionals, but still it shows that interaction.
So you have these big system level things like rural access and then personal tools too.
Both fitting under efforts to maintain or promote well-being.
There was another example too, something about limitations.
Ah, yes, about limited healthcare services in certain settings, like residential ones.
That highlights the access issue again, doesn't it? That these efforts aren't always available everywhere.
It really does. And you notice the hyphenation there, perhaps. Healthcare services.
I did. Sometimes it's two words, sometimes one, sometimes hyphenated. What's the deal with that?
Well, Merriam-Webster notes it.
Yeah.
It often gets hyphenated when it acts like an adjective before another noun.
Like healthcare costs or healthcare system.
Exactly. It's a small point, maybe, but useful to know.
So this first definition is really about doing the active work by professionals for our well-being, physical, mental, emotional,
That's a good way to put it. The fundamental purpose.
which is probably why you're listening to get that deeper grasp. Okay, what about definition number 2?
So the second one shifts focus. It defines healthcare as the people and organizations that provide healthcare.
Okay, so not the actions, but the actors.
Pretty much. The system, the industry, think hospitals, clinics.
Doctors, nurses, insurance companies, the whole shebang.
Right. The example given is straightforward. Jobs in healthcare. That immediately points to the scale of it all.
And we saw an example using the single word healthcare here, didn't we?
We did, mentioning problems that face healthcare, using it as a noun for the entire sector.
So it's the collective structure that delivers the efforts from definition 1.
Precisely. If definition 1 is the verb, definition 2 is kind of the noun, the entities involved.
And the hyphen comes back here too sometimes, like healthcare workers.
Or healthcare industry.
Yeah.
Same principle as before modifying the noun that follows.
Got it. So two sides, the work being done and the system doing the work.
Exactly. And looking at the broader context, especially from the medical definition section, really adds layers.
How so?
Well, there was a quote describing American healthcare as being at a crossroads.
A crossroads. What does that imply in this context?
It suggests a point of decision, challenges, the quote, highlighted amazing technology.
Which relates to definition 1, better efforts, better tools.
Right. But it also mentioned big problems, things like inefficiency, high costs, quality issues.
Disparities in who gets care.
Yeah, and the number of people without insurance. It shows the system, definition 2, struggling to deliver on the promise of definition 1.
So the people and organizations are facing hurdles in actually providing that well-being for everyone.
That's the tension, yes.
Yeah.
But technology is also trying to bridge some gaps.
Like telemedicine.
Exactly. An example highlighted how telemedicine improved the quality of healthcare even during the pandemic.
So that's the system adapting, using new methods to achieve those core efforts.
Trying to, yes. And another example really brought it back to the people within the system.
What was that?
It was about PPE, protective gear for healthcare workers.
Ah, right. Protecting the providers themselves.
Which is fundamental, isn't it? The well-being of the people and organizations, definition 2, is crucial for them to be able to deliver the care definition 1.
It really shows how linked these two definitions are. You can't separate the efforts from the system providing them.
They're completely intertwined. Understanding both is, well, essential for any real discussion about healthcare.
It's more than just treatment. It's this huge, complex ecosystem. Did they mention when the term first popped up?
They did, actually. First known use, 1906.
1906. Okay, so over a century old, but maybe not as ancient as some might think. It grew with modern medicine.
Seems likely, and it's interesting that they even have an article discussing whether it should be one word or two.
So we're not the only ones who wonder about healthcare versus healthcare.
Apparently not. It reflects common usage questions.
Okay, so let's quickly recap then. What are the key takeaways from Merriam-Webster?
2 core meanings. First, the efforts. Maintaining, restoring, promoting well-being, physical, mental, emotional, by trained professionals.
The actions.
Right. And second, the system, the people, the organizations, the industry responsible for delivering those efforts.
The actors and the structure.
Exactly. The efforts in the system.
And really getting that distinction, but also how they connect, helps make sense of, well, pretty much everything discussed about healthcare.
Policy, costs, access, innovation. It all touches on one or both of these definitions.
It gives you, the listener, a framework for thinking about it all.
Absolutely. When you hear the term think, are we talking about the goal and the actions or the system delivering them? Often it's both.
So thinking about both those angles, the efforts towards well-being and the complex system providing them, here's something for you to chew on.
Okay.
What do you see as the biggest challenge or maybe the biggest opportunity facing healthcare today, considering both that mission and that structure?
That's a great question. It really forces you to connect the dots.
Definitely something to think about. Thanks for taking this deep dive with us today.